The benefit of standardization is to make the daily lives of biomedical teams and hospital practitioners easier.
It's pretty easy for staff to use this new monitor. The connectors are universal between oxygen saturation and invasive blood pressure.
Thanks to its flat surfaces, we can clean the CARESCAPE system without missing a corner or an edge. Disinfecting the equipment is easy. We have many doctors and teams within the facility who work in shifts. The advantage of having the same equipment on all 3 sites is that you can adapt its configuration according to each medical specialization. It also allows us to swap equipment between departments when needed. Only 1 training session is required for all rotating teams. This monitor allows us to make life easier for all our teams. This type of monitor, which is very flexible, will allow us to escalate treatments and when it gets complicated, to monitor invasive blood pressure quickly, for example. It's important to have flexible, compact, and discreet equipment, especially for pregnant women.
The uniformity of the monitoring allows us to provide optimal patient care. When we admit patients coming from the emergency department, since these are the same devices used in intensive care, the practitioners who work in these departments are familiar with the monitors and immediately understand how to use them.
Patient data is continuously recorded when the patient is transported from the operating theater to the recovery room. This is an advantage and a safety feature for the patient. The monitors are easily connected to the hospital IT network via the CARESCAPE gateway. A concrete example is to be able to directly access from the patient's records via the Muse interface the 12 ECG signals acquired at the patient's bedside. This is really useful. Instead of spending time locating an ECG device and bringing it back to the room, this monitor saves us from doing the job twice.
This monitoring system is also good for patient comfort. It won't interrupt their sleep since it has a function which mutes monitoring and alarms at the patient's bedside, but with the monitoring continuing on the central console.
This solution allows us to have an overview of our fleet of equipment, to manage the fleet in a uniform way, to have only 1 maintenance contract and the same consumables on the 3 sites. The CARESCAPE solution from GE Healthcare brings us many benefits.